everybody. We are here with Dr. Fernando talking about heart health for Heart Month. He is part of our Unity Point Health Des Moines cardiology team. So we're just going to jump right in.
Absolutely, let's do it.
All right. So the first question is, do I have to go into your office for all of my appointments?
Traditionally, we have had in-person visits, but now we have three options: in-person visits, telephone visits, and video virtual health visits. We have put in several safety measures, including screening our physicians and staff members for symptoms, wearing masks, washing hands, using hand sanitizers as necessary, and maintaining safe social distancing.
All right, next question. How does heart disease affect women differently from men?
I got a nice slide for you. Let's look at this slide now.
Awesome.
Women are usually older than men and tend to have a higher number of risk factors. When in women who have diabetes, it increases the risk for heart disease 3 to 7-fold, as against men about 2 to 3-fold. Blood pressure, especially the top number, is much higher in young men. The total cholesterol seems to be similar, but the LDL bad cholesterol is much higher in men when they have heart disease. If you have a lower good cholesterol, that tends to affect women more. In a Danish study, the association between smoking and heart disease was higher in women than in men, in those who smoked. Most importantly, we need to know the differences between men and women when it comes to heart attack symptoms. In men, the symptoms are nausea, vomiting, squeezing chest pressure or pain, shortness of breath, jaw and neck radiation, and cold sweats. However, in women, they may have the same traditional symptoms, or they may not have any of them. Instead, they may present with mild pain or pressure in the lower chest and upper abdomen, fainting, indigestion, and extreme fatigue. If you have these symptoms, women should not ignore it. They must seek medical attention.
All right, the next question. GERD versus chest discomfort. When should a person go see a doctor?
Most often with GERD, symptoms such as a sour or bad taste in the mouth, bad breath, tooth decay, difficulty swallowing, nausea or vomiting are present. However, if the accompanying symptoms are absent, or if you've already taken medications for GERD, then you must be concerned about heart disease as well. If the chest pain becomes worse, if it's retrosternal, if it starts radiating to the left arm or to the right arm or to the jaw, I would seek medical attention immediately.
All right, next question. I have varicose veins and have noticed that they bother me less the more I exercise.
Yeah.
Does that have to do with how strongly my heart pumps? Is there one type of exercise that is better for my heart than others, such as running versus lifting weights?
Excellent question. Now, the heart doesn't pump the blood backwards. The pumping action of the heart forces the blood through the arteries and into the capillaries. The blood from the tissues in the leg have to return back to the heart against gravity. Okay? Only the residual pressure that is created remains for the transfer of venous blood against gravity. The venous system uses a very complex pumping mechanism to establish this. The force moving the venous blood is generated in the leg muscles. Through the natural movement of legs, the veins are pressed together and then pulled apart, creating a pressure suction effect so that the blood is kept flowing. The venous valves prevent the blood from being pushed backwards against the direction of flow. The flaps of the valve open when the muscles press against the vein, squeezing the blood forward, and then close when the muscles relax, preventing the blood from leaking backwards. The last part of the question was, is there one type of exercise that is better for my heart than others? The American Heart Association recommends 150 minutes of exercise in 1 week. Okay? We start with moving more and sitting less. We add intensity to our exercise regimens. We do traditional aerobic exercise such as treadmills, ellipticals, and bikes.
All right, next question. How long do today's drug-eluting stents typically last?
First of all, let's talk about what a stent is and why it was needed. Okay?
Yeah.
When you have a blockage in a coronary artery, right, we first have to open up the artery. Traditionally, we used balloons to get there and then inflate it to create the space for it. What happened then is the artery sometimes collapse back after we pull the balloon out. In order to keep the artery open, we needed a metallic scaffold to keep it open. That's why we put stents in. Initially, we called it bare metal stents because there was only a metallic scaffold. Nowadays, we have drug-coated stents. Okay?
Okay.
Now, why do we need drug-coated stents then? Because each time we put a balloon and inflate it, or put a stent and injure it, the tissue beneath it starts growing as a repair process. Okay?
Yeah.
So then you can get re-occlusions, or the same blockage may occur again. Okay? Stents usually last forever because it's metallic. However, it can get blocked up again. For bare metal stents, it's higher. The drugs that are in the stent sometimes can slow it down by around 75%. Okay? The first generation stents, they started occluding at a rate of around 13 to 16% at 5 years. The newer stents, which have newer drugs, are occluding around 5% at 5 years. So they tend to stay open longer.
Thank you again for joining us today and answering our questions.
The pleasure is all mine.
Just a reminder that this month is Heart Month. We were here talking with Dr. Fernando at Unity Point Health Des Moines cardiology team through heart health questions. If you have more questions, please refer to the number on this post and reach out to the team.